Phil Morgan from the University of Manchester, and welcome to the next in my series of short presentations around contact lens discomfort. In this talk I'm going to be trying to explain exactly what is the sensation of contact lens discomfort and what is the etiology of this phenomenon that's so important and has so much impact on our professional practice. Now, if you'd like to know more about this very fascinating area, I'd suggest that you download this volume of investigative ophthalmology and visual science. It was published in 2013, and it is the complete report that was put together by TFOS, the Tear Film and Ocular Surface Society, on this topic of contact lens discomfort. It's about a 200-page document, but if you search online for TFOS contact lens discomfort, you'll find it. Now, this document had a whole load of information, but also what it did do was to define what we mean by contact lens discomfort. What we don't really mean here is the sort of sensation you might get with an identifiable clinical cause. You know, you might have a seal related to contact lens use, and that can be a bit irritable, and you know, it's sort of obvious what that is. But what we're talking about here with the term contact lens discomfort is the kind of grumbling daily discomfort that some wearers get due to their contact lenses. So here's the definition. Contact lens discomfort is a condition characterized by episodic or persistent adverse ocular sensations related to lens wear, either with or without visual disturbance, resulting from reduced compatibility between the contact lens and the ocular environment, which can lead to decreased wearing time and discontinuation of contact lens wear. So what are the key terms here? Well, we're talking about adverse ocular sensations. It's related in some way to reduced compatibility between the lens and the ocular environment, and it can go on to lead to reduced wearing time in sort of hours per day, or ultimately discontinuation of contact lens wear. Now, some other terms get used. It can be a bit confusing, the terminology in this area. One term that sometimes comes into play is contact lens associated dry eye, or contact lens related or induced dry eye. We should try and avoid that terminology for this particular issue. That terminology really is reserved for people who have dry eye disease that might be exacerbated by the presence of a contact lens. So contact lens discomfort should be used differently from something like contact lens induced dry eye. And we should also try and avoid using the term contact lens dryness. This probably does not come about because the lens or is particularly dry. So contact lens discomfort is the term I'll be using, and I think it's something we should try and use more widely. So what exactly is going on here? Well, here's the system that we're dealing with, this rather elegant video, a clip taken by Carol Maldonado Cadena and Michael Reed. So here's what we're dealing with. We've got a contact lens on the ocular surface sitting in the tear film, and we have eyelids that move over the contact lens, and something about this system isn't going quite right when we get contact lens discomfort. So let's have a look at this sort of in a more animated style. So here we have the contact lens shown here in this sort of pale blue or turquoise color. We've got a post-lens tear film behind that and a pre-lens tear film in front of that. And around this we have the eyelids, which I think are very important here. Now, when we get a dry spot on the front of the contact lens, this is thought to promote a blink. And what's probably very important is that the tear film is able to fully lubricate that blink. Look at how, when this eyelid comes down, and how we have quite a high volume of tears that sort of are entrained over the front of the contact lens to allow the lens to be fully lubricated once again. So here comes the eyelid down, and yes, the tear film is now fully recovered. So there's something about this system that doesn't quite work in some patients, and we get contact lens discomfort. Well, from a biological point of view, we know that the nerves that supply the ocular surface, they come from the ophthalmic division of the trigeminal nerve. They move to the front of the eye. Now, in terms of the cornea, what we know is that entering radially into the cornea at the stromal level, we've got about 80 nerves at that level. They then sort of start to divide, and then there's about 500 of these nerves move up through the anterior limiting membrane into the lower reaches of the corneal epithelium, and then they all start to join up at this point, and we get this rather elegant plexus people have reported and put together using composite images of confocal microscopy pictures. So we've got this very dense plexus of nerves. The cornea is probably the most sensitive part of the body. What do we know about the nerves? Well, we know about 70% of them are polymodal. That is, they respond to really any sort of stimulus causes these nerves to respond. It's not very discriminating. And maybe that's because we've evolved from an evolutionary point of view, just so that we're not really concerned about what it is that's causing a stimulus at the ocular surface. We just need to sort of get away quickly from it. So that's most of the nerves. The remaining nerves are of twofold. One type is more mechanoreceptors, so they're the ones that probably are giving us the sensation when we get something in our eye, a bit of grit in our eye, or a fingernail in the eye, or something like that. And a minority of nerves are cold receptors, and we perhaps don't fully understand what they're all about. Now, what's interesting is these polymodal receptors seem to have reduced levels of output when there is a consistent stimulus. They seem to adapt to a consistent stimulus. Maybe that's why a contact lens becomes fairly comfortable. We can adapt to a lens that when it goes in for the first time. But some of these nerves, that does not apply when we get local inflammation. So there's an inflammatory response. Those nerves keep on firing. And there might be something there that helps us understand contact lens discomfort. Now, when we look experimentally at the sensations of the system at the ocular surface, we do find, unsurprisingly, that it is the cornea, the central cornea, which is the most sensitive tissue at the ocular surface. This is work that I'm presenting here, done by my former PhD student, Maria Navasquez-Cornago. The graphic on the right-hand side of this slide shows that it's the central cornea, which is the most sensitive. The lowest numbers mean more sensitive. And as we look across the other bits of the ocular surface, we can see that next, in terms of sensitivity, are the eyelid margins, which are also relatively sensitive. And sort of least sensitive is the tarsal conjunctiva and the bulbar conjunctiva. So, perhaps because of this, there's quite a lot of interest now in the role of the lid margin, sometimes called the lid wiper, in contact lens discomfort. Indeed, the work of Don Korb and Caroline Blackie suggests that this particular area is really important. In their model, they suggest that when we have good lubrication between the eyelid and the cornea, we can think of that in a contact lens wearer perhaps as the eyelid and the contact lens surface. So when we have good lubrication, we have a lot of tear film and the right sort of tear film, then these tissues are going to be just fine. But when there's a breakdown in lubrication in this area, then we might see local inflammation. Firstly, some sort of micro trauma as the mechanics of the situation start to disrupt the cells, and then actually a local inflammatory response. So it might be that this is what we're seeing in contact lens discomfort. And it's because of this that we now have a lot of interest in what we see on this slide here, lid wiper epitheliopathy. You can see when we put stain into the ocular surface that some cells here on the lid margin or the lid wiper take up this stain, and this being given the term LWE, lid wiper epitheliopathy. And this might also be an important feature in contact lens discomfort. The literature is a little bit variable in this area, but certainly if we look at the work here of Korb, we see on the left-hand, so the left-hand pair of columns here, that in contact lens wearers with discomfort or symptomatic contact lens wearers, we see a much higher proportion of that group with LWE than on the left here are patients who are asymptomatic. They don't have symptoms, much less likely to have lid wiper epitheliopathy. So this part of the system also seems to be important. Now, at the moment, there's quite a lot of interest in subclinical inflammation during contact lens wear. Now, the link between this and discomfort is not yet established, but I think there's good reason to believe that this might be a fruitful area of research. Now, what do we mean by subclinical inflammation? Well, we mean viewing things as shown here on a confocal microscope, trying to see inflammatory cells in the cornea or in the lid margin or in other parts of the ocular surface conjunctiva. And we do know that this alters with contact lens wear. in work we've just recently published. We know that prior to contact lens wear, there's relatively few of these cells apparent, but when we put a daily disposable lens on the eye after a week, we see a very small increase in these cells, a much bigger increase when we use reusable lenses. So contact lens wear is altering the inflammatory status of the ocular surface. We don't fully understand this. We don't really know how much of a role this has to play in contact lens discomfort, but my feeling is this is likely to be quite important, and as we begin to know more, we might start to more fully understand the mechanisms behind contact lens discomfort. And the role of these inflammatory cells and how they interplay with the nerve vessels in the cornea, I think is really fascinating. Here's some very recent work out of Australia from Colorado and co-workers, and in this work they've been tracking these inflammatory cells, dendritic cells here, in the subbasal plexus of the corneal epithelium, and you can see how these nerves seem to move, seem to be talking, the cells almost seem to be talking to the local corneal nerves, and this interplay between the inflammatory cells and the local nerves, I think, is really likely to be important for understanding contact lens discomfort. Fascinatingly, they found that these cells move at something like 1 micron per minute when they're in the cornea. So, all of that I think is important. There might be some other things that are relevant as well. What about osmolarity of the tear film? Of course, this is something that we can readily measure now in practice, or perhaps particularly in dry eye speciality practices with this sort of device, where you can get an immediate measure of tear film osmolarity. Well, why might this be important? Well, I think this might be important in contact lens discomfort because of what we see going on in dry eye disease, where dry eye disease is now recognized to be this vicious circle that is occurring at the ocular surface, and an important part of this is the osmolarity changes in this disease, in particular tear hyperosmolarity that is now acknowledged in dry eye disease. Well, this is thought to lead to a local inflammatory response that ultimately leads to quite an uncomfortable eye. And it might be something like this is important also in contact lens wear. That would seem to me to be quite likely. But we need to understand exactly where it fits in. What about the mechanism of the blink? This presumably has some sort of role to play, but yet it's something we don't understand very much about. My colleagues Michael Reed and Maria Navasquez Cornago again have been working on a new system, a high-speed infrared camera that allows us to track the movements of the eyelids during a blink. And something about this system might be causing contact lens discomfort or have some role to play, or maybe it will allow us to get an objective measure of contact lens discomfort. Surprisingly, we don't know so much about the blink. And note how this upper eyelid, of course, moves a long way. We know about that. But actually, the lower eyelid moves a long way also horizontally during the blink. So there's a lot more to be understood here. So what is contact lens discomfort? Well, we don't have all the answers. It's generally poorly understood. I think we know all the main players. This must involve, I think, the tear film, the movement of the eyelid, during the blink, cornea, conjunctiva, the lid margin, the lid wiper. All these, I think, have some role to play, but we do not know the relative importance of all of these players, or in fact the interdependence between them all. So we need to know a lot more about this area. And probably some important factors also that really currently are not well understood, even more so. Osmolarity, the mechanical interaction of the lens and the ocular surface, and I think a big player for the future is the inflammatory response. So that's what we know about the etiology of contact lens discomfort. In the remaining talks in this series, I'm going to be talking about how we can quantify contact lens discomfort, exactly what are the local causes of contact lens discomfort, and how we can manage this situation to improve comfort of our contact lens wearers such that we can minimize the number of dropouts that we see so much in contact lens practice.